Have you ever felt back pain that just won't go away? Most of the time, back pain is harmless, but sometimes it's the body's way of warning us about something serious. In this video, I'll reveal the hidden signs that your back pain might be linked to dangerous conditions, and when you need to see a doctor immediately. If you care about your health, make sure to watch until the end. And don't forget to like, share, and subscribe. It really helps more seniors get these life-saving tips. When back pain signals something serious, Part 1. Why seniors must take back pain seriously. Back pain is one of the most common health problems in the world. According to Harvard Health in 2023, nearly 80% of adults will experience back pain at some point in their lives. For younger people, it is often linked to muscle strain, poor posture, or minor injuries. But for seniors, the story is very different. The American Geriatric Society reports that chronic back pain is now one of the leading causes of disability in adults over 65. That means back pain is not just discomfort. It can limit independence, mobility, and even shorten life expectancy if left untreated. Most back pain is not life-threatening, but sometimes back pain is the body's warning signal that something far more serious is happening beneath the surface. Missing these red flags could delay treatment for conditions that require urgent medical attention. As the spine ages, several changes occur. The cushions between the vertebrae dry out and shrink, leading to stiffness and pain. Bones become weaker from osteoporosis, making fractures more likely, even after a minor fall or a simple movement. Arthritis and inflammation cause wear and tear in the joints of the spine, and reduced muscle strength weakens the core, offering less support for the lower back. These changes are common with age, but they also make it harder to distinguish between normal aging pain and pain that could signal a dangerous condition. Doctors emphasize that certain patterns of back pain demand urgent attention. According to Mayo Clinic in 2022 and the World Health Organization, you should not ignore back pain when it appears with other symptoms. One warning sign is back pain with unexplained weight loss. Losing weight without changing diet or exercise combined with chronic back pain may signal cancer or systemic disease. Research from Johns Hopkins Medicine in 2021 shows that cancers that spread to the spine often begin with persistent, unexplained back pain. Another sign is back pain with fever or chills. This may suggest a spinal infection, such as vertebral osteomyelitis or a spinal abscess. While rare, these infections can progress quickly and cause permanent damage if untreated. A third warning sign is sudden severe pain after a minor injury. For seniors with osteoporosis, even a small fall or sometimes just bending forward can trigger a compression fracture. According to the National Osteoporosis Foundation, more than 700,000 spinal compression fractures occur each year in the United States, mostly among older adults. Finally, back pain with numbness, tingling, or weakness in the legs should never be ignored. This could indicate a herniated disc or even spinal cord compression. Symptoms like difficulty walking, loss of balance, or sudden bladder problems are clear red flags. If you have ever felt any of these warning signs, do not brush them off. Share your experience in the comments, because it may help someone else who is going through the same struggle. And always remember, your story could save another life. So while most back pain in seniors is mild and manageable, pain that comes with weight loss, fever, trauma, or nerve symptoms should always be taken seriously. These are the early whispers of your body telling you to act before it is too late. In the next part, we will dive deeper into the red flag symptoms that demand emergency medical care and how doctors use science to separate ordinary back pain from serious disease. Back pain in seniors often develops slowly, but it can also appear suddenly and change daily life in an instant. Many older adults start by dismissing the pain as just aging, but science shows that ignoring early signs can make recovery much harder. Studies published in the Journal of the American Medical Association in 2020 highlight that seniors who delay treatment for persistent back pain have a higher risk of permanent mobility loss. Another important factor is how back pain interferes with daily activities. If bending, standing, walking, or even sleeping becomes difficult for weeks at a time, that is not normal aging. It is a sign that the spine or surrounding nerves may be under serious strain. Seniors often adapt by moving less, but less activity leads to weaker muscles, stiffer joints, and even more pain, creating a vicious cycle. Doctors also warn that pain intensity is not the only signal. Even mild back pain, if constant and paired with systemic symptoms like fatigue or night sweats, can suggest something more than a strained muscle. According to the Centers for Disease Control and Prevention, spinal infections and inflammatory conditions are frequently underdiagnosed in older adults because they mimic ordinary backaches. Real patient cases also reveal how subtle warning signs can be missed. For example, an elderly man with ongoing back pain that worsened at night turned out to have multiple myeloma, a type of cancer that often attacks the spine first. Another patient ignored back pain with mild tingling in the legs until the numbness progressed so rapidly that walking became impossible. Only then did doctors discover spinal cord compression requiring emergency surgery. These examples remind us that back pain in seniors is not always simple. For family members and caregivers, paying attention to patterns is essential. Is the pain getting worse over weeks instead of better? Does it wake the person up at night? Is there a loss of appetite, fever, or new weakness in the legs? Each of these combinations provides doctors with critical clues. Medical experts like those at Mayo Clinic recommend that any senior who experiences new back pain lasting longer than 6 weeks or pain associated with other health changes should seek a medical evaluation. Early diagnosis often means simpler treatment, whether it is medication, physical therapy, or addressing an underlying disease before it progresses. Ignoring these signals can have serious consequences. Osteoporosis-related fractures may heal poorly if left untreated, leading to chronic deformity and severe disability. Spinal infections can spread to the bloodstream, becoming life-threatening. Cancers discovered late in the spine are harder to treat and may already have spread to other organs. The good news is that many of these outcomes can be prevented with timely attention. Science has made great progress in identifying red flag symptoms that should never be ignored. Seniors and their families need to be empowered with this knowledge so they can act quickly and protect long-term health. So while occasional stiffness may be part of normal aging, persistent pain with unusual symptoms should never be dismissed. Your back pain might be the body's way of whispering that something more serious is happening. Listening to those whispers and taking them to your doctor early could make all the difference between a simple solution and a life-changing diagnosis. When back pain signals something serious, Part 2. Red flags that demand immediate medical attention. When does back pain cross the line from discomfort to danger? Doctors use the term red flag symptoms to describe warning signs that suggest a potentially life-threatening condition. These are not symptoms to monitor casually at home. They are signals to seek immediate medical evaluation. One of the most urgent red flags is back pain combined with sudden bladder or bowel problems. Difficulty controlling urination or loss of bowel control can indicate cauda equina syndrome, a rare but severe condition caused by compression of the bundle of nerves at the base of the spine. According to the American Association of Neurological Surgeons, this is a surgical emergency. Delay in treatment can lead to permanent paralysis or incontinence. Another critical red flag is back pain accompanied by rapidly progressing weakness in the legs. If an older adult suddenly finds it hard to stand, climb stairs, or even walk without stumbling, spinal cord compression may be to blame. Research from the National Institute of Neurological Disorders and Stroke highlights that early intervention in spinal cord compression can mean the difference between full recovery and lifelong disability. Severe back pain that wakes a person up at night or worsens when lying down also raises concern. While ordinary muscle strain usually improves with rest, pain that intensifies at night may suggest spinal tumors or infections. A study published in The Lancet Rheumatology in 2021 emphasized that nocturnal back pain in seniors should always be evaluated, especially when combined with fatigue, fever, or weight loss. Persistent back pain following cancer treatment is another warning sign. Cancers such as breast, lung, or prostate often spread to the spine. Johns Hopkins Medicine notes that metastasis to the spine can present first as back pain long before other symptoms appear. Ignoring this sign can allow cancer to progress silently. Sudden, sharp back pain accompanied by chest pain, dizziness, or shortness of breath may also signal an aortic aneurysm, a dangerous enlargement of the body's main blood vessel. The U.S. National Library of Medicine warns that older adults, particularly men with a history of smoking or high blood pressure, are at greater risk. Back pain from an aneurysm is not muscular. It can be fatal if the artery ruptures. Infections of the spine, although rare, are another life-threatening condition. Pain accompanied by fever, chills, or night sweats must be taken seriously. The Mayo Clinic describes spinal infections as difficult to diagnose early, but devastating when missed. They can destroy bone, compress nerves, and spread to the bloodstream. Early detection through MRI and blood tests can save lives. Doctors also advise that severe back pain following even a minor fall should be evaluated promptly. In seniors with osteoporosis, a seemingly harmless incident can cause a vertebral fracture. The World Health Organization estimates that 1 in 3 women and 1 in 5 men over 50 will suffer an osteoporotic fracture in their lifetime. These fractures not only cause pain, but also increase the risk of future fractures, loss of mobility, and higher mortality rates. Emergency departments often stress that timing is everything. If back pain comes with sudden neurological changes, severe systemic symptoms, or unexplained deterioration, waiting is dangerous. Every hour matters in conditions like cauda equina syndrome, spinal cord compression, or spinal infection. Beyond the physical risks, ignoring these symptoms can deeply impact quality of life. Seniors may lose the ability to walk, care for themselves, or enjoy independence. Families often struggle with guilt when warning signs were overlooked. That is why awareness and rapid action are crucial. The reassuring truth is that modern medicine offers many effective treatments if these conditions are caught early. Emergency surgery for nerve compression, antibiotics for spinal infections, radiation for metastatic tumors, and minimally invasive procedures for fractures are now far more successful than in the past. Early diagnosis turns a crisis into a manageable condition. So how should seniors and their families respond? The answer is clear. Never ignore severe or unusual back pain. If pain is constant, worsening, or accompanied by symptoms like fever, numbness, weakness, or bladder problems, it is time to see a doctor immediately. Calling emergency services is the safest choice when symptoms appear suddenly or escalate quickly. Back pain does not always mean danger, but when these red flags appear, it must be treated as a medical emergency. Acting quickly can prevent irreversible damage, preserve independence, and in many cases save lives. In the next part, we will explore how doctors diagnose serious back pain conditions, the tests they use, and what patients can expect from science-based treatments that restore mobility and reduce suffering. When back pain signals something serious, Part 3, Diagnosis, Treatment, and Final Message. When seniors arrive at the doctor with persistent or red flag back pain, the first step is always a careful medical history. Doctors ask when the pain started, what makes it worse, and whether symptoms like weight loss, fever, or numbness have appeared. These details often provide the first clues. Next comes a physical examination. Doctors check posture, reflexes, strength, and sensation in the legs. Even simple tests, such as asking a patient to walk on their heels or toes, can reveal whether nerves are affected. To confirm serious conditions, imaging is essential. X-rays detect fractures or spinal deformities. MRI is the gold standard for identifying infections, tumors, or nerve compression. CT scans provide detailed images of bone structure. Blood tests may uncover infection or inflammatory disease. In some cases, bone density scans are used to confirm osteoporosis. Treatment depends on the cause. For fractures, bracing and medication may help, but surgery is sometimes needed. Infections require strong antibiotics, often given in the hospital. Spinal tumors are treated with surgery, radiation, or targeted therapy. When nerve compression threatens mobility, emergency surgery can restore function. Even in less critical cases, physical therapy, anti-inflammatory medication, and supervised exercise programs improve mobility and reduce pain. The most important message is this: serious back pain is not something seniors must simply live with. Science now offers effective ways to diagnose problems early and treat them before they cause permanent damage. Acting quickly makes recovery faster, outcomes better, and independence stronger. So if you or someone you love experiences back pain that feels different, pain that is constant, worsening, or paired with red flag symptoms, take action today. Do not wait, do not guess, and do not hope it goes away on its own. See a doctor, get the right tests, and follow science-backed solutions. Back pain does not define aging. With knowledge, early diagnosis, and the right care, seniors can continue living active, independent, and fulfilling lives. Thank you for watching. If you found this video helpful, please like, share, and subscribe so more seniors can get life-saving information. And in the comments, let us know which sign surprised you the most. Your voice may inspire someone else to take their health seriously.